Ahead and get started. We have a busy day ahead of us, or a busy next 90 minutes. So welcome to our Life and Health Industry meeting. We have some updates that we want to share from MIA about key activities in this space that we've been working on, as well as looking forward to the 2026 legislative session and beyond. But we also want to hear from folks on the phone too. So hopefully we'll have some time for discussion at the end. If people have questions along the way, you can raise your hand or put something in the chat. If you raise your hand, we'll move you over so that you can address your question verbally, but also please feel free to put questions in the chat. We are monitoring that chat. Let's go ahead and get started. But before we dive in, actually, I just want to make sure that folks know the MIA team on the phone today. I will turn it over to Joy to introduce herself and ask you all to pass it around.
Good afternoon, everyone. Joy Hatchett, Deputy Commissioner. Van?
Good afternoon. Van Dorsey, Counsel to the MIA. Jamie? Look.
Good afternoon, everyone. Jamie Sexton, Associate Commissioner of External Affairs. Mary?
Mary Quay, Associate Commissioner for Market Regulation and Professional Licensing. Brad?
Brad Bobin, Chief Actuary. Joy?
I've already done mine, but Craig, why don't you go ahead and introduce yourself?
Hi, everyone. I'm Craig Guy. I'm Chief of Communications here at the Maryland Insurance Administration.
All right, great. Just another little housekeeping item. This meeting is being recorded. So by remaining on the call and at any time if you speak up or ask something in the chat, please know that that will be recorded and that you're consenting to being recorded by staying on the meeting. So with that, let's dive into our agenda. I think our first agenda item that we had was an update about consumer complaints in our complaint system. I think we're actually going to hold on that update until a later session. Just broadly, we are working to update our complaints portal for both P&C and Life and Health. And we're going to have some more information because there's obviously going to need to be some industry input in testing as we continue to build that model out. Joy, I don't know if you had anything else you wanted to add. You've been so involved with this on the P&C side.
No, the only thing, Marie, is that for any of you that were around when ECTS was introduced, you may have been involved in sort of helping us test it out and have an opportunity to give input. We are going to do something similar to that at this time around, and you'll get plenty of notice about that.
Thanks, Joy. So our next agenda item is updates on the various life and health work groups and reports from the 2025 legislative session. So I'm going to give a couple of updates and then turn it over to Mary to give updates on several items. The first update is on the Maryland Health Insurance Coverage Protection Commission. That body's work has not yet kicked off. I believe we are still waiting for a few additional appointments for that body to be able to meet. So more to come there. Jamie, do you have any more recent updates than that?
No, we've been keeping our finger on the pulse there, and there haven't been any substantive updates. So you're spot on, Marie.
Okay. Great. The next update is about the work group to study the rise in adverse decisions in the state healthcare system. I think as folks know, that is a group that has been fully appointed did have its first meeting last month. And we're sending in a notification to the General Assembly that we intend to submit that report on or before December 1st, 2026. So that body will be very busy over the next year or so, examining its various charges and making recommendations. So those are my updates. I'm going to turn it over to Mary to talk about the PBM work group and some other reports that we've just submitted.
Okay, thank you. For the PBM work group, House Bill 813 of 2025 created this work group with MIA, MDH, and specific stakeholders. The work group will extend into 2026 and covers topics related to both insurance and Medicaid. The 4 meetings so far have focused on insurance issues, including court decisions on ERISA preemption, coverage of specialty drugs, including a definition of specialty drugs, and sections 15.16.11.1 and 15.16.12 of the insurance article, which relate to anti-steering and reimbursement, have been discussed, and discussions will continue next year. A draft interim report was circulated to members of the work group, and pharmacists on the work group have proposed edits, which the MIA and MDH are reviewing and discussing. The definition of specialty drug is an important topic and one that we want to review in more detail. And next year, the work group will complete its discussion of insurance topics and move on to more focus on Medicaid. The report on mental health parity and QTLs has been completed. I did not see it on our website yet, but it should be there soon. Section 15.144, which requires the NQTL analysis reports and data supplements, was amended in 2024, and we received the carrier's analysis filings July 1st of 2024, and we have been busy reviewing those in great detail. The 2023 MIA interim report had described problems with insufficient reports, and none of the NQTL filings we received that year were complete or sufficient to determine compliance. And so the 2023 interim report by the MIA made recommendations which were adopted into law in 2024. And I am pleased to say that for the 2024 filings, we had some sufficient reports. Not on the initial submission, but we were able to get several reports, filings of NQTLs to be sufficient to determine compliance. Some were compliant, and others we have sent out notices of non-compliance. Unfortunately, we also had a number of insufficient reports, and we are drafting orders on those. The 2025 report reviews the filings and major issues that we saw with the filings, including the number of incomplete filings or insufficient filings. It reviews the 2024 federal regulations that are not being enforced by the federal government right now. But there are portions of those regulations that the MIA believes are very important to effective enforcement of mental health parity. And so our recommendations largely focus on those aspects of the federal regulations that we think the state should adopt. And while there were too many incomplete reports, I do want to thank the carriers that worked with us and got to a point where they had sufficient filings, and thank you very much for your cooperation in that regard. Finally, we have a report on dental credentialing. The MIA was asked to review whether dental plans were using online credentialing systems for providers. The Market Analysis Unit sent out a survey, and the report with the results has been issued. The MIA's survey of 30 companies found that 5 plans do not currently use an online credentialing system. 17 plans accept forms through the CAQH system. 3 companies accept the CAQH form, but not online. And 6 plans use both their own proprietary online system and CAQH. And that wraps up my comments on work groups and reports.
Great, thanks so much, Mary. Okay, our next agenda item is a 2026 legislative update. So I'm going to turn it over to Jamie Sexton to give an overview of our departmental bills relating to life and health.
Thank you, Commissioner. We have a lot of content to go over, so I'm going to be speaking about these in concept at a relatively high level. We have officially gotten the green light from the governor's office to be able to share language. So if you have specific questions about specific provisions and statutory changes that are being made, please don't hesitate to reach out. When I'm done with this update, I'll provide my email in the chat. Don't hesitate to reach out if you would like to review that language in more detail than what we're going to go over here today, just for the sake of time. First up on the list, we have a bill related to SHOP enrollment. This bill is seeking to update the special enrollment periods within the Small Business Health Options Program, or SHOP, for small employers. This is going to help eliminate conflict between Maryland's health insurance laws and federal standards regarding health plan effective dates. As I think many people on this call are aware, under current law, if an applicant submits their application after the 15th of the month, their coverage doesn't start until the month after next. This bill allows employees to have their coverage kick in from the first day of the following month, regardless of when in the month they submit their applications. By simplifying these effective dates, this change aims to reduce confusion and ensure that employees maintain continuous health coverage. We also think that these adjustments create a more streamlined enrollment process that benefits both small businesses in Maryland and their employees. Next up is the codification of certain federal requirements for mental health and substance use disorders. This proposal aims to codify certain aspects of the federal rule that enhances the enforcement of parity requirements for mental health and substance use disorders into Maryland state law. Most people attending today's call are aware that this proposal is coming in the wake of federal agencies under the current federal administration announcing that they would cease enforcement of these rules. While some provisions of the 2024 final rule align with MIA's existing interpretations, new important requirements will be proactively included in state law to protect Maryland consumers. These include definitions for mental health conditions and substance use disorders that align with the International Classification of Diseases or the Diagnostic and Statistical Manual of Mental Disorders. It also supports the prohibition on the use of discriminatory factors and evidentiary standards when designing NQTLs by requiring carriers to collect, evaluate, and act upon relevant outcomes data pertaining to NQTLs, and requires carriers to ensure that meaningful benefits for mental health and substance use disorders are provided on par with those for medical and surgical services. It's important to highlight also that this bill was intentionally designed to delink Maryland's law from federal requirements where necessary to ensure stronger consumer protections in mental health care in the state. Third on the list here is our departmental related to material changes to provider networks. This proposal aims to improve the notification process when a significant change occurs in a carrier's provider network. Specifically, it would mandate how and when carriers must inform the commissioner of potential material network changes prior to the effective date of termination. Also, the requirements for carriers' notices to enrollees would have to include additional information such as contact information for the MIA. To enhance oversight, it would also mandate that carriers inform the commissioner of potential significant network changes prior to their effective date and ensure timely notification to affected consumers when providers leave the network. The proposal will also include provisions as the following. A provision that requires health carriers and hospitals involved in a contract dispute to adhere to their contractual terms, including reimbursement conditions, for 90 days following contract expiration or termination. A provision that extends these 90-day contract protections to any provider of behavioral health services from whom the carrier has received a claim in the prior 3 months. A provision extending the required notice before removing a provider from the network to 90 days. A provision requiring that health carriers and participating providers provide each other with at least 90 days written notice if they intend to terminate or not renew their contracts. The carrier is also required to make a good faith effort to inform affected patients at least 30 days prior to the termination date, unless they agree in writing to extend the contract for up to a year. And a special enrollment period clause for the individual market in instances of significant network changes. That one was a lot. Sorry, guys. The fourth one on our list deals with issuance of MedSup policies. This proposed bill enacts 2 63-day special enrollment periods to allow certain consumers to acquire a guaranteed issue right to purchase a MedSup plan. The proposal ensures that individuals losing full Medicaid or certain Medicare savings programs that help people with limited income and resources pay for their Medicare costs, and these are CLIMBY and SLIMBY plans, have alternatives outside of Medicare Advantage plans to cover the remaining 20% of the cost of Medicare-approved services not paid by Medicare. It also addresses inconsistencies for older Marylanders who become eligible for Medicare before January 1st, 2020, allowing them the same plan options as younger beneficiaries. While existing law permits policyholders to switch to these plans without underwriting during their birthday month, older beneficiaries face hurdles unless they navigate a currently very complicated process to access these plans. This legislation aims to simplify their choices and protect their access to necessary coverage. And then last on the list is third-party administrators. This proposal is seeking to broaden the scope of violations that third-party administrators or TPAs can be penalized for, making sure they align with various infractions outlined in the insurance article. It also expands the commissioner's authority to revoke a TPA's registration if they violate the insurance article. Currently, revocation can only happen under certain conditions, like a felony conviction. This would allow for direct accountability of TPAs when they breach the insurance article, such as MAPIA violations, without the need to take separate action against each health carrier utilizing the respective TPA committing the infraction. And that covers it.
And Jamie, I just want to add on that last one and then want to invite Mary to comment as well. I think it was something we're seeing particularly with unauthorized health plans and the sale of unauthorized health plans is those often come through TPAs and we often have limited ability to address the TPA infraction, even when there's very clear violations of Maryland law. So Mary, I don't know if you want to comment further on that.
Yes, it is a problem that we have seen with some of the unauthorized health plans that we've taken actions against, where in some instances we can also take actions against a producer selling the plan, but not necessarily the TPA that might be operating and providing marketing materials for the plan. Yeah.
Great. I want to pause there because that was a big update and a lot, and see if there are any questions from folks on the phone. And again, you can raise your hand and we'll move you over, or you can put a question in the chat. Mike Zimmer. Craig, can you move Mike over?
Yes, you should be moving now.
Okay. Hi, Mike, you can unmute and ask your question. Mike, if you're talking, we can't hear you. You're on mute. Okay. What, maybe we can, oh, there you go. Are you able to speak, Mike? Okay, let me see while we're waiting for Mike. Any other questions from folks on the call about that legislative update? Okay, Mike, are you able to speak? Okay. Well, let's move on to the next agenda item and we'll have some more time at the bottom of our agenda to have discussion and go back with any questions. So our next item is an update on regulations in the life and health space. And I'm going to turn it over to Mary Clay again to give an update.
Okay, thank you. I wanted to talk about some regulations that we are considering. And so the first up is provider directory regulations. And the MIA is drafting regulations related to provider directories. This has been a matter of some concern for advocacy groups, consumers, regulators. And so we have looked at what a lot of other states have done. Currently, our law is Section 15112 of the insurance article, and Section 15112P offers two options to verify directories. A carrier may either periodically review at least a reasonable sample size of the directory for accuracy, or contact providers who have not submitted a claim in the last 6 months. And so the regulations are based on the first option, defining time intervals for periodically, and the percentage of listings that constitute a reasonable sample size. We're aware of the argument that the No Surprises Act requires review of the entire directory every 90 days. We did not see that other states have adopted that standard, and we are not putting that in the regulation. But we do want to ensure that there are substantial reviews and that the entire directory is reviewed at some point over the course of time. And if carriers are unable to accomplish that, the statute does permit them to elect to review providers who have not filed a claim in the last 6 months. In response to our public meeting earlier this year, the MIA received requests to designate CAQH as the source of provider information. The MIA has authority to designate a multi-carrier common online provider directory information system under Section 15112.3 of the insurance article. And this was considered, but CAQH is no longer a nonprofit and thus does not meet the criteria for the selection of the system in the statute. We are considering a provision in the regulation that would permit a carrier to rely upon the data in a CAQH verification by the provider in order to update the provider directory. We are still working on those internally, but we will post them for comment before they move further. Level funded plans. We had a public meeting on November 21st, and the record remains open for comments until December 5th. The National Association of Benefits and Insurance Professionals presented information about the sale of level funded plans. and areas of concern, including the sales materials and adequate disclosures to small employers, including whether small employers even understand all the time that they are creating a self-funded employee benefit plan instead of buying an insurance product. The presentation slides are on our website. And as a result of this meeting and listening to all of these concerns and concerns that we have had internally, we are considering whether the MIA should revise the current disclosure that stop-loss insurers are required to give small groups, and whether any additional requirements for producers and insurers are appropriate. We did receive a comment letter suggesting that some of the CE required of producers who sell health insurance should include education on level funded plans. And we believe that employers should be fully informed as to what they're purchasing, whether they are buying a stop loss product or a product that will fully insure their health plan, and what their obligations and risks are when they take on a level funded plan. And again, comments on that are open until December 5th. Thanks.
Thanks, Mary. Any questions from the audience for Mary? Oh, Michael Patty is asking for a Comar citation for the provider directory change.
I don't think we have one yet because this will be a new regulation.
All right, does that help, Michael? I got it, thanks. Any other questions for Mary? Okay. So I'm just going to, then our next agenda item, I just wanted to flag my appreciation. We put out a bulletin October 20th, specifically relating to accommodations for the federal shutdown and encouraging our carriers to make accommodations for to prevent those impacted by the shutdown from losing coverage due to non-payment of premium. And I just wanted to say that we had many of our carriers issue accommodations, and I think that was really helpful to the consumers of our state. And so I just wanted to express my thanks for that. Our next agenda item is items coming in 2026. And I think you heard some of a session update, as Jamie mentioned, and she's gonna put her email in the chat for folks, but we do have quite a few departmentals that we'll be working on in the 2026 legislative session, and we'd be happy to set up time to discuss those departmentals in more detail. I think just generally, and I'm looking at Brad Bowman, our chief actuary, we are also watching, as I'm sure many of you all are, on the progress or lack of progress on enhanced APTC extension in Congress, and what that means. I think in Maryland, we are in a relatively good place with our state subsidy for this year, but I expect the health of our ACA markets, both individual and small group, will be a key source of discussion and planning. I think we want to make sure these markets are accessible and affordable for folks, and we look forward to working with you all on ideas where we can help make sure that Marylanders have quality, affordable options. So let me pause there, and Joy, Mary, Van, Jamie, anything I missed or that you would like to chime in on? I also know some of our carriers on the phone may be very interested in the family implementation. I think Carol Lamb is in the audience. If there are questions specific to that, please feel free to ask and we'll see if we can get you some answers or get back to you on those. Okay, and Mike, thank you so much for the long comment, and yeah, we can't hear you, but I think I see concerns about the birthday rule and the impacts on premiums and the Medicare supplement market, and we can definitely reach out to you. I know that we have been seeing rising premiums in Medicare supplement plans. Brad, I don't know if there's anything we can comment on at this point in time.
I would say that the majority of rising premium has not been attributed to the birthday rule, at least in the filings, that it's due to underpricing, initially, not and not giving increases in early years of policies. But I do think there is some upward pressure from the birthday rule, but we don't have a quantification of it.
And then there's a question asking about when the NQTLs for the 2026 filing will be identified and released to the carriers. Mary, do we have an answer for that yet?
We don't have a firm answer. It is something we have been discussing. And I hope that by early in January, but I'm reluctant to give a firm date until we have it set and ready to go.
Wonderful, thank you. Well, we'll be keeping everyone posted on that. I think lots of folks will be interested in it. Okay, any other questions? From anyone on the phone? Or any concerns that you're seeing and want to make sure that we're addressing in our work? Anything you're seeing in the market? Anything at all? Okay. Well, this can, I think, be a short meeting then. Thank you for all for joining us. We'll, I'm sure, be in touch on many things in the next month in the new year. Really appreciate you joining this meeting. And please keep in touch with us if there are concerns that, again, that you're seeing in these markets. Please don't hesitate to reach out. And hold on, there is a comment about the birthday rule. Seems to be some discrepancy with the birthday rule and if an application has to be submitted during that time or the effective date. It seems to vary amongst carriers. So thank you. I think both Mike and Tracy for flagging some of these birthday rule issues. We'll be in touch. Mike, thanks for your phone number, and Tracy will definitely look into the issue that you're raising. Any other questions? Thanks, Matt. Thanks for the offer to review. I'm sure we'll look forward to the feedback. All right. Thanks, everyone. Have a great afternoon, and we'll be in touch soon. Thank you.